Well, hey everybody, this is Robert, and welcome to Outbreak News TV. Well, if you see in the upper left-hand corner of your screen, we're over 4 million coronavirus disease 2019 cases as of May 10th. And I wanted to take a close look at kind of the black sheep of the world right now, and that's Sweden. And they're doing things a little bit differently than the rest of us. Some say for good, some say for not so good. And we'll take a look at some of it today. But if we take a look at Sweden, they've got just about 26.3 thousand cases so far. They're a population of about 10 million total. And their death total so far is a little over 3,200. So that's what Sweden looks like today. Now, in this article, it says Sweden has gained attention worldwide for its unique approach to managing the virus. The country has not implemented many of the lockdown measures taken around the globe. For instance, while gatherings of more than 50 people are banned, restaurants and bars have remained open. This gentleman's name is Michael Ryan. He's the Chief Executive Director of the World Health Organization's Emergencies Program, said in a briefing recently that the country has, however, adopted a range of measures to help tackle the virus. Sweden has ramped up its intensive care capacity, has a strong public health policy around physical distancing, and key protections in place for those in long-term care facilities, all of which have helped its healthcare system cope with the COVID-19 cases. The major difference in Sweden's approach is trust in the population. Ryan said, quote, "What it has done differently is it is very much relying on its relationship with its citizenry. It really has trusted its own communities to implement that physical distance. That trust, combined with strategic controls and clear communication, could provide a template for other countries that are loosening lockdown restrictions to safely adapt to a new normal." And I really hate that term, the new normal. It's back to normal, guys. Ryan said, quote, "If we are to reach a new normal," his words, "in many ways Sweden represents a future model." Still, Ryan cautioned on Sweden's strategy. It remains to be seen whether its approach will be fully successful or not. And that's so true. And I'm not judging Sweden one way or the other at this point. I personally think they are taking the right route. I'm probably the minority, but we're not going to know that for a long time to determine if this has been successful or if it was a abysmal failure. But we will be keeping our eyes out on that. Sweden is doing worse than other Nordic countries. Sweden's strategy is unique compared to elsewhere in Europe, where countries like Italy, Spain, and the UK have issued strict stay-at-home orders and lockdowns to help prevent the spread of the disease. Now remember, the UK started out with a Sweden-like policy, and they quickly turned tail on it. And right now, the UK is one of the hardest hit countries on the planet with COVID. The results of herd immunity attempts remain unknown, and that's true too. Sweden, that's their philosophy when you're dealing with this, is herd immunity. And Michael Osterholm has told me in the past that it's going to be about 65 to 70% people infected do get herd immunity in a population. And it also remains unclear if antibodies from COVID give people immunity and for how long it lasts. Again, another unknown in the Sweden experiment. This article from the Business Insider says, the architect of Sweden's unusual coronavirus plan even said he's not sure if the relaxed approach is working. Quote, "I'm not convinced at all," Anders Tegnell, Sweden's state epidemiologist, told Swedish media, adding that his team is continuously evaluating the approach. Quote, "I think the most important thing all the time is to try to do it as well as you can with the knowledge we have and the tools you have in place." He continued, quote, and to be humble all the time because you may have to change. So those are fair words, in my opinion, very fair. This is from Statista, and it's the coronavirus deaths worldwide per 1 million population as of today. And if we take a look at it, Sweden is number 6 in the world with 316.21 deaths per million. Behind, actually far behind, Belgium, Spain, Italy, and the UK, and France. And they're in front of the Netherlands and Ireland, also in Europe. So all the top countries are in Europe. And then the United States, so it's 6, 7, 8, 9th. So that's where Sweden lies as far as deaths per million. They are by far not the worst, not even close, but they are up there, number 6 in the world right now. Visible pandemic. And he writes, many countries and members of their press media have marveled at Sweden's relaxed strategy in face of the coronavirus disease 2019 or COVID-19 pandemic. Schools and most workplaces have remained open. Police officers were not checking one's errands in the street. Severe critics have described it as Sweden sacrificing its elderly to quickly reach herd immunity. The death toll has surpassed our 3 closest neighbors, Denmark, Norway, and Finland, but the mortality remains lower than in UK, Spain, and Belgium. It has become clear that a hard lockdown does not protect old and frail people living in care homes, a population the lockdown was designed to protect. Neither does it decrease mortality from COVID-19, which is evident when comparing UK's experience with that of other European nations. PCR testing and some straightforward assumptions indicate that as of April 29th, more than 500,000 people in Stockholm County, Sweden, which is about 20 to 25% of the population, have been infected. 98 to 99% of these infections are probably unaware or uncertain of having the infection. They either had symptoms that were severe, but not severe enough for them to go to the hospital and get tested, or no symptoms at all. Serology testing is now supporting these assumptions. He goes on to say, these facts have led me to the following conclusions. Everyone will be exposed to severe acute respiratory syndrome coronavirus 2, and most people will become infected. COVID-19 is spreading like wildfire in all countries, but we do not see it. It almost always spreads from younger people with no or weak symptoms to other people who will also have mild symptoms. This is the real pandemic, but it goes beneath the surface and is probably at its peak now in many European countries. This is a very good point. There is very little we can do to prevent the spread. A lockdown might delay severe cases for a while, but once restrictions are eased, cases will reappear. I expect that when we count the number of deaths from COVID-19 in each country, in 1 year from now, the figures will be similar, regardless of the measures taken. Measures to flatten the curve might have an effect, but a lockdown only pushes the severe cases into the future. It will not prevent them. Admittedly, countries have managed to slow down spread so not to overburden healthcare systems, and yes, effective drugs that save lives might soon be developed. But this pandemic is swift, and those drugs have to be developed, tested, and marketed quickly. Much hope is put in vaccines, but they will take time. And with the unclear protective immunological response to infection, it is not certain that vaccines will be very effective. In summary, he writes, COVID-19 is a disease that is highly infectious and spreads rapidly through society. It is often quite symptomless and might pass unnoticed, but it also causes severe disease and even death in a proportion of the population, and our most important task is not to stop the spread, which is all but futile, but to concentrate on giving the unfortunate victims optimal care. So I think Giseki is really on the opposite end of the spectrum from much of public health, and particularly here in the United States, from Dr. Fauci and others. And it's a very interesting way to look at this pandemic. And it'll be interesting. I would like to know if people subscribe to that. I mean, what do you think? I would like to hear your comments about that down below. Then I'm going to go to this article in The Hill. This was from last week also. And it says the U.S. should follow Sweden's approach to combating COVID-19. And it says, many governors are refusing to lift their COVID-19 shelter-in-place decrees until a long list of conditions are met. They have phrased their recalcitrance in the language of science. As California's Gavin Newsom put it, science, not politics, must be the guide. We can't get ahead of ourselves. I don't want to make a political decision that puts people's lives at risk. Now, as a matter of science, the governors are wrong. They assume that they are making a trade-off of a short-term reduction in employment for a long-term reduction in age-specific mortality. They are actually making a trade-off of short-term reduction in COVID-19 deaths for a long-term increase in age-specific mortality for working people and their families. The governors have made this error in judgment because they are not taking into account the basic facts about COVID-19 and about the mortality risk from mass layoffs and poverty. Let us start with the facts about COVID-19. First, it is highly contagious. Second, a very large percentage of those infected are asymptomatic. Third, precisely because it is highly contagious and many cases are asymptomatic, infection will continue to spread until a vaccine becomes available or herd immunity is reached. Government actions such as lockdowns, contact tracing, mandatory social distancing, and the like will not influence the total number of people who are ultimately infected. They only influence how many people have active infection at any given point in time. All of these actions flatten the curve, but they do not affect the area under the curve. And a lot of this is sounding a lot like Dr. Giesecke from Sweden. Fourth, no one knows the infection mortality rate from COVID-19, but there is broad agreement that the number is substantially lower than the 3.4% initially published by the World Health Organization, which only included symptomatic cases in the numerator. Indeed, the higher the percentage of asymptomatic cases, the lower must be the infection mortality rate. And fifth and finally, the mortality risk facing a young person from COVID-19 is minuscule compared to the mortality risk faced by an old person. The CDC's most recent report shows that people over the age of 65 account for only 16% of the total U.S. population, but they comprise 79% of all COVID-19 deaths. People under the age of 35 account for close to half of the U.S. population, but comprise less than 1% of all the U.S. COVID-19 deaths. And let's now add a few basic facts from research in economics about the mortality effect of unemployment and poverty. First, as the research of Daniel Sullivan and Till von Walker at the Quarterly Journal of Economics shows, mass layoffs during recessions increase both the short-term and long-term age-specific mortality risk of laid-off workers. For middle-aged male workers, mortality rates in the year after being laid off are 50% to 100% higher than they would have been otherwise. Second, a large body of research shows that the loss of employment in middle age produces a permanent long-term reduction in income because of reduced employment prospects. That is, layoffs push families toward poverty. Third, the effect of poverty on age-specific mortality is brutal. In the United States, the poor die 10 to 15 years earlier than the wealthy. So what inferences can be drawn from these facts? And they go on. I just want to touch on a couple of them. Governors who persist in statewide lockdowns are making a huge mistake. They think that they are safeguarding workers and their children from COVID-19. They are actually exposing them to mortality risk from unemployment and poverty. None of this is to say that governments should ignore the threat, and that's obviously this is a very serious threat, but you shouldn't be taking this to hysterical levels. It is a highly contagious disease that poses a very serious threat to the elderly. But there's a middle ground approach to COVID-19 that does not create the lose-lose outcome now on offer from some of the governors. That approach currently being applied is in Sweden. It boils down to protecting the elderly and those with comorbidities while allowing everyone else to get back to work. So protecting the elderly, that is the key to all this, right? I think a lot of the evidence points to that. In my state, the bulk of the fatalities are people 65 and older, and I'm sure that's true throughout the country and throughout the planet. So, but I want to take a look at some people that don't necessarily agree with the Sweden model, and I want to close out with that. And that's 22 scientists who say, now this is an older article. This was from April 14th, so it's nearly a month old. And this is from Forbes. And it says 22 scientists say that the coronavirus strategy in Sweden has failed. And Sweden's relatively relaxed approach to controlling the spread of the coronavirus has come under fire in international media and from many locals in the capital of Stockholm, where more than half of the country's deaths have been recorded. Now there's 22 researchers that have publicly criticized the strategy and called on politicians to make changes. In an opinion piece published in the Swedish news source Dagens Nyheter, I hope I pronounced that right, the group of researchers from a range of top Swedish universities and research institutes made harsh criticism of the Swedish Public Health Agency and their present coronavirus strategy. They say that elected politicians must now intervene with swift and radical measures. The researchers say that the agency has claimed on 4 different occasions that the spread of infection has leveled out, despite evidence to the contrary. And they point out that the slowdown in infections and deaths in Finland, which has implemented a much more restrictive measures. Major public events, such as the start of the Swedish soccer season, are postponed, and the physical buildings of universities are closed, but otherwise, everyday life continues. Schools remain open. Now, the Swedish Public Health Agency hit back at the criticism, calling the claims inaccurate. The criticism comes as the Swedish death toll hits new heights, and that's old news, so I want to pass that. And of course, the researchers kept on highlighting Finland, which has recorded a lot less deaths than Sweden on a per-person basis. But they were on a much stricter lockdown format. While Swedish authorities have stopped short of implementing many of the emergency measures seen in neighboring countries, they do recommend that people stay at home and avoid unnecessary travel. According to Jan Lutval, a professor at the University of Gothenburg, said that Swedish people may have not understood the seriousness of the situation because they have received an unclear messaging from health authorities and elected officials. The researchers now want rapid change. They suggest that schools and restaurants should be closed, as in Finland. In addition, healthcare professionals working with the elderly must use proper PPE. Well, that kind of goes without saying. Swedish health authorities have hit back. They say that the figures, there's some fundamental errors in their figures, and they point out that in some countries like Italy, they only record deaths that occurred in hospitals, which make it difficult to compare the number of deaths between different countries. Anyway, so I think over time, early on, Sweden was getting blasted. Sweden still gets blasted today from the U.S. president for their policy toward this. But I think over time, people are starting to see that maybe they were onto something, and they have a much more reasonable approach to this without destroying their economy and the sanity of the population. But there's still people out there that, especially people that would historically be Sweden lovers, right? And this is the great place that Bernie Sanders talks about. But yeah, a lot of people are not agreeing with us, and they think we should be in the United States locked down for a much longer time while the economy tanks and tanks. So herd immunity, that's clearly an option. And like Dr. Gesicki said, let's take a look at this in a year from now, and we'll see which program worked out better. I'm I have my thoughts on that, and I kind of lean. I really lean toward the Swedish model. And I'd love to hear what you got to say. Sweden, did they do it right, or are they like bat crazy? Right? Did they just totally screw this up? Let me know down below. What do you think? Have they done less damage to their economy while trying to protect the elderly as best they can? I mean, this virus isn't going anywhere. It's going to take some time, and then it's going to run its course. And I think let me know. Do you think they're taking a reasonable approach to the COVID outbreak, the pandemic? Let me know. If you like the video, go ahead and like it, share it with your friends, and please let me know what you think. And I'll see you next time on Outbreak News TV.